And good afternoon. It is now Tuesday, May 30th, 2023. I'm Dr. Deuk. We're at the Deuk Spine Institute Surgery Center VR. We're getting ready to start surgery on a patient's lower back. He's actually had a fusion before. It was not done by me. It was over 10 years ago. And he hurt his back a long time ago. Lay still. He hurt his back around 40 years ago. He's had back pain, right leg pain for 40 years. He had a fusion. It didn't help him. It made him worse. The fusion was done by a different doctor, an orthopedic surgeon, whose name shall go not mentioned. It's not important. The fusion itself looks good to me. Can you show them the x-ray, Henry? Can you see that?
Yes, we can.
So you can see the screws and rods. Jordan will show you the screws. You see the threads and the rods and the connectors. And then show us the cage that's located at L5-S1, the cage, the inner body cage. Keep going with your arrow to the inner body space. Are you having trouble, Jordan? The cage. Jordan, yeah, there you go. You guys see those black lines there? They mark a cage that's located inside the L5-S1 disc space. So now the patient has L4-5 herniation and a far lateral herniation on the right. Are we ready? Lay still.
Lay still for me. Don't move your arms. Okay?
All right. Our patient is awake. He's twilight anesthesia. We're going to get started. We just need you to lay still. Now, the reason patients are awake is I need their help getting down to the spine. Shot. All right. Wait. I want to be a little bit higher than I am. Go back in. We're going to, where you enter the body, the skin is very important. And I want to get in exactly the right spot. So Jordan, I would like for you to show me a little more posterior. I'd like you to, I think you're centered okay on 4-5, but I'd like to see a little bit more posterior. You're doing great. I'm just going to give you some numbing medicine. So the step one here is going to be access the L4-5 disc in a transforaminal manner. Shot? Okay, that's it right there. Better. You can see the L4-5 disc just above his fusion, and that's where he has a very large herniation. That herniation is foraminal, meaning in the foramen, neuroforamen. Shot? The neuroforamen is the hole where the nerve exits the spine. Can you show us that hole, Jordan? Shot? Yep, that's it right there, where the arrow is. Okay, it's a small little hole. And that's where everybody's nerves leave their spine. Shot? So right now I'm trying to work around the facet. There we go. And once I get around this facet, then I'm going to be inside the disc, inside the foramen and then the disc. Yes? You having any pain? And this is where I need my patient's help. Shot? All right, so far so good. AP, let's get those pedicles lined up. Next time when you come back, I think you need to fix the WAG. Folks, the most important thing right now is to have reliable navigational information. And what that means is I need to know, yep, that looks great. I need to know my path. And I know the path based on the spinal anatomy. Basically, I know the path based on my targets. And my target right now is the facet joint at 4-5. And then once I get to that, I go past it. That's perfect. And I go into the disc herniation below. So I'm going to go back just a little bit, and I'm going to redirect south a little bit. Shot? That's better. See that, how I came down about a degree? And then I'm going to go medial right into the herniation. Shot? Where do you feel that? AP? Show us on that view the foramen and show us the needle tip. You guys see that? Needle tip right in the foramen. Yep, show us the whole foramen. Beautiful. Nice job, Jordan. And there's the tip of the needle. So I'm actually hitting the herniation. I can feel it right now. He's got a big herniation in the foramen at L4-5. Yep, and I think it was missed by his prior surgeon. I honestly think they missed it. So they did a fusion at 5-1, but they missed the 4-5 herniation. Happens a lot. It's called a foraminal herniation. Foraminal, F-O-R-A-M-I-N-A-L, foraminal. Ooh, man, that is bouncing and behaving. All right, are you awake?
You awake? He said yes. He's awake. Okay. Keep your head still for me, okay?
That's a big tear. All right. So what we know about this particular patient is he has, just wait, lower back pain, 40 years. Just wait on that.
Yeah.
Okay, you see that?
Yes, we do.
And right lower extremity pain. He's had a fusion, and the fusion did not help him. We don't promote fusions, they're bad. Now we're going to fix the real problem, which is the L4-5 disc. L4-5 herniated disc. That's where his back pain's coming from, and that's where his leg pain is coming from on the right side. Any questions from the audience? Let me know when he's reliable.
No current questions, so we do have a comment from Royal ViewTube on YouTube
Okay.
saying genius at work.
Oh, thank you so much. So let's go ahead and run the video explaining how herniated disc actually cause back pain.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Okay, now you see why herniated disc can cause back pain. It's inflammation in the posterior annular tear. That was discovered at Deuk Spine Institute. Our patient is comfortable. How bad is that?
Give us a number.
On a scale of 1 to 10, what's the highest it goes?
What number?
1 to 10.
Huh?
All right.
10. You said 10.
Is that where you typically get back pain?
You said yes.
All right, so folks, we just tested L4-5, and it's 10 over 10, and it's concordant. Concordant means that's his typical back pain he gets every day. Why is that important? Well, if you're creating back pain during surgery, if I'm hurting somebody, like if I start hitting the guy with a hammer right here, then he's going to have pain right here, right? You can't hit somebody with a hammer, they don't have pain. So if I hit him here, he's going to have pain here, but that's not where his typical pain is every day. When I did the discogram, it elicited a pain response from a disc, and that is his typical pain, right there, L4-5. That's what we're here to fix today. So not only is the herniation causing back pain, but it's also causing weakness, numbness, tingling in his leg. And you can see on the discogram, there's a huge tear. Show us the tear. Huge tear in the back of the disc. That's all the black stuff. Big, big, big. The whole disc is just torn, shredded. All right, now we're going to go into that disc, and we're going to fix it with a laser. Show us how the Deuk laser disc repair works to fix pain coming from a herniated disc.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. a Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Welcome back. Now you understand why is it that a herniated disc can be so painful. It's the tear in the back of the disc causing inflammation. All right, we're now entering the herniated disc through the foramen. I know it looks like we're going straight in, right? But we're not. Let's go ahead and, by the way, this goes in so easily because there's a huge tear. Let's go ahead and do an AP shot, and then let's get a quick AP. We're going to show you that our dilator going into the disc is not going straight in through the back. It's coming from the side. It goes through a hole in the side of the spine. And show us the hole in the side of the spine. Yeah, that's just part of it, but go up and down. It's pedicle to pedicle. So where's the pedicle of L4? Show us, there it is. And then where's the pedicle of L5? There it is. Now see the space between the pedicles? That's the foramen. That's the area we're passing through to get the dilator in. We're going to do the whole surgery transforaminal. All right, looking good. Let's get the fluoro out. Oh, sorry. No, you're right, the tube. I apologize. All right, next. So you guys see this, Henry?
Yes, we do.
The whole surgery is going to be done through a 7 millimeter wide tube. 7 millimeters. Don't believe me, eh? There you go. 7 millimeters. Not a millimeter more or less. So this little magical shake straw, we call it, is going to go down, sliding along the dilator. Remember, this all started with a needle that I placed, and that needle has to be placed exactly right, and that's where it all starts. As long as you get the needle placed properly, the rest of the surgery goes well, without a hitch. Okay? All right, now we're inside the annular tear and the herniation. At this point, we're going to bring the scope and the laser in to do the Deuk laser disc repair. Any questions?
We have a person seeking for a vice. This comes from Charlene on Facebook.
All right, Charlene, we'll take your question. Or
They said, I've had 2 fusions, both failed. I've had fusion on L3 to S1, and my back and leg pain with numbness throughout my groin, including inability to feel the need to urinate and or if it empties completely. My spine is very complicated, and I have been turned away by multiple doctors and surgeons, along with bilateral hip fixation and a cage. Can't forget that ever.
well, we can help you. All right, first of all, Deuk Spine Institute can get rid of your pain. There is no doubt in my mind. We're not like any other spine center in the world. And the reason why is we, first of all, figure out where your pain comes from. And that's honestly pretty easy to do with a physical exam over Zoom and a history, which we do at the same time, and we look at your MRI. So use the link that Henry's going to put on there. It's mri.deukspine.com, and use that link to send us your MRI. We'll do a quick Zoom meeting, and we'll figure out exactly what's wrong and what needs to be done to fix it. I have no doubt, though, if you're having pain, we can figure out what it is causing it, and we can fix it. The most common cause of back pain by far is a herniated disc. Now, there's many names for a herniated disc. Some people call it a protruded disc, extruded disc, ruptured disc, slip disc, herniated disc, bulging disc. But in the end, they're all the same. A snake is a snake is a snake, okay? And, you know, there's lots of different names for snakes, but in the end, they're all snakes. And the problem is that you've got an injury to a disc, most likely that's causing your pain. And it's been missed by your doctors. The other option is that your pain is coming from a joint called the facet joint, F-A-C-E-T, or the SI joint, or the piriformis muscle. Those are by far the most common causes of back pain, and even hip pain. The SI joints, for example, if you have sacroiliac joint dysfunction or a sacroiliitis, inflammation of the SI joint, then you're going to end up having pain below your fusion, right next to your butt crack. It's going to be horrible, and it can radiate into your pelvis and in your hip. So the treatment for that is what's called an SI joint rhizotomy. You don't need a fusion of the SI joint. A lot of doctors will tell you you do because they want to make money on fusions. Fusions pay surgeons very, very well. The way the surgeons make the most money is fusions. I get paid the most doing spinal fusion, but I discourage people from having it because it's bad for them. And I want to do what's best for my patients, not what's best for me financially. And most surgeons, though, they don't prioritize their patients' needs. They just prioritize their needs. Have you ever noticed that about doctors? It's true. Most doctors that I know don't put their patients first. They put themselves first. And that's especially in pain management. It attracts those kind of doctors. The doctors that put their needs ahead of their patients' needs. It's not true in pediatrics. It's not true in primary care. But it is true in pain management. And the reason is that there's so much money to be made in the spine world by doctors doing spine procedures. It attracts the worst, in my opinion, the worst doctors into the spine field. They're greedy, they're selfish, they don't really care about their patients, they just care about the money they're making doing spine procedures. And I speak from lots of years of experience dealing with these guys and gals, mostly guys, because I go to meetings. I see what they're doing. And I try to teach them less invasive ways of treating their patients that work. And they don't want to hear about it. They literally ignore the truth. A better way of caring for patients in place of doing procedures that pay well and that never fix the patient's pain. Think about it. If your goal is to just keep making money on people's backs and necks hurting, then why would you ever want to fix them? That's how most chiropractors are. I hate to say it, and I'm not trying to bash on chiropractors, but that's the God's honest truth. They know that they've got a lifetime patient, because as long as that patient doesn't get surgery to fix their back, then that patient's going to keep coming back to them as long as they're alive. Well, guys, gals, it's time to shift away from this exploitation of the masses with back and neck pain and start fixing people permanently so their pain is gone and they don't need to keep going to the doctor for treatment. And the only way that's going to happen is to, number one, make the right diagnosis, what's causing the pain. And in a lot of people, it's more than one cause. Like this guy right here, okay? I can tell you right now, his biggest problem is for his right leg, pinched nerve, is this L4-5. But he's also got herniations at 2, 3, and 3, 4. And I told him that. But he wants to just fix this one disc right now, and that's fine. He may end up coming back and needing the other ones done. But I gave him the choice of fixing it all or just doing a little bit. And the same thing, I saw a patient from California, right? We did her last week. She had 12 different causes of back pain, 12. She had SI joints, bilateral, trochanteric bursitis, bilateral piriformis. So that's 6. She had like 3 discs, 7, 8, 9. And then she had a couple of facets, 10, 11. And then she had an ischial tuberosity tendonitis. Look at that herniation right there. So she had literally 12 causes of back pain. And I'm going to tell you right now, if we only fix one, she'd have 11 still there. So everybody's different in what's causing their pain. However, the causes are all the same. It's no magic to it. We figured it all out at Deuk Spine. That's why you're best off coming to somewhere like Deuk Spine where they make the right diagnosis. Now, there are literally 1 million doctors treating back pain in the United States. And of those million, 999,999 do not know how to make the right diagnosis. I hate to say it. And the reason is, no, there's been no training, there's been no emphasis on making the right diagnosis. Because doctors are literally taught to believe there's no way to cure back pain. That's what they're told from day one, right? But that's not the truth. The truth is we now know how to cure back pain and neck pain. We just have to find the source. And that's the hard part, folks. Most doctors don't know about it, therefore they can't do it. All right, we'll take some more questions. So far the surgery is going well. In case you've never seen the surgery done, the laser is the glass tube that you're seeing there. And it's transmitting energy from a machine located here in the operating room, a very big and expensive machine, mind you. It's called the Holmium YAG laser. It's totally FDA approved. Everything we do uses FDA approved equipment and supplies. So we're doing an FDA approved procedure using a Holmium YAG laser. It's a 100-watt Holmium YAG luminous laser. And it does two things, by the way. It delivers energy, it creates laser energy, which is very powerful at removing pathological tissue. It's also used in urology procedures, gynecology procedures, neurosurgery procedures, all over the world. Lasers are getting more and more popular. But it also creates a blast wave, a sound wave, basically underwater, that is called a cavitational wave. And that cavitational wave delivers mechanical energy, not just what do you call it, electromagnetic energy, but mechanical energy. So you have two things, mechanical and you have electromagnetic radiation, which is the laser energy. It's a form of light energy, but not visible light. Anyway, that's the mechanism of action. It works with two types of energy, mechanical and electromagnetic. And that's what you're seeing at work right here, fixing this guy's herniated disc at L4-5. Questions?
Okay, next
less
questions
than
come
5
from
minutes.
Charlene on Facebook.
Give me 1 second. Dr. Berndes, less than 5 minutes.
Thank you for letting me know.
Yes, Charlene, on Facebook. Welcome to our live stream.
They asked, so do you do revisions? I am told I need a higher fusion and my neck is also needing work. Horrible pain. My quality of life is non-existent. I also cannot feel my fingertips on my left hand, and up and down my arm is very painful and numb. I am treated horribly like a drug seeker.
Yeah, I'm so sorry, Charlene. Honestly, I feel horrible for you. You're not a drug seeker. You're like so many millions of people that are just, I hate to say it, thrown out on your ear by your doctors. You can blame them, and they should be blamed. But you can also try to understand why they treat you this way. It's because they were taught to treat you this way by their superiors, by their doctors, their mentors. Okay? It's been believed for the longest time that pain is not curable and that people just need to suck it up, buttercup. And we found that that's not true, that pain is curable and there's always a reason. So you don't need to be taking pain pills anymore. Just come to us and we'll figure it out. What you should do is get your MRI to me through our website, mri.deukspine.com. Let me do a quick interview and figure out what needs to be done. Okay, but yes, we can definitely fix your pain. We can cure it, eliminate it, so that you don't ever have to deal with it again. Yeah, you can see our testimonials on YouTube. We have literally thousands of patients we've cured their pain. And we can cure yours as well. Just because you've had surgery doesn't mean it can't be done. All right, and I just told my anesthesiologist we have 5 minutes left. You can see the surgery is going very well. This is the end of the disc right there. And that's the epidural space. There's a little bit of ligament, a little bit of soft tissue.
Got good blood pressure.
Yep, yeah, everything's going well. So I'm just finishing up this L4-5 herniation. I'll be done in less than 5 minutes. And this will be our last surgery for today, by the way. We have a bit of a light day. I guess my staff thought that I would be not ready to work 100% when I got back from Memorial Day. Hopefully everybody had a great Memorial Day yesterday. I was working a little bit on our new website, which unfortunately we had to find a new team of developers because the guys that I hired basically stole our money and didn't produce anything. So I found what I believe is going to be a good option, and I've been working on trying to get this new site done, because everything I'm teaching you guys here is stuff that I want to have it on the new site so that people have access to it 24/7 and they don't have to go and watch the whole live stream to learn things, you know? I want people to have the truth available to them. Let me have the grabber. So I've been using the laser the whole time. Now I'm going to introduce the pituitary rongeur or grabber and see if I can grab out any pieces of herniation. I can tell you it's all pretty tough in here. Fibrous, we call it fibrous. Fibrous is scar tissue. So this patient's had inflammation going on here for a long time, and it's resulted in a lot of scar tissue. That's how scar tissue is made, folks, inflammation. When you have a lot of pimples on your face and they're inflamed for years, you get scars, you know, scar tissue. Scar tissue is a direct result of inflammation. Remember, your inflammatory system is your body basically attacking something that it thinks is not supposed to be there. In this case, it's attacking the herniated disc. All right, 1 minute left.
We have another question.
Sure.
This comes from Charlene once more on Facebook. And they said, I am the furthest thing from that. I am just trying to get back to work as a nurse. My people are treating me this way. How can I ever encourage my patients to seek help if I'm treated this way?
Yeah. Listen, I empathize with you. I'm going to tell you something. A lot of our patients are nurses. And they find us at Deuk Spine. They see what we're doing and they recognize it as being the solution. You are not a drug seeker. You're a product of your environment. And unfortunately, patients can't get drugs without doctors giving them to them. So who do you think created all the drug addicts? That IV poll is right in my view. Who do you think created all the drug addicts that are on the street right now that are heroin addicts doing heroin and fentanyl? It's doctors. Doctors did. Why? Because that's how we treated chronic pain. We had no other way to treat it except to give patients morphine, Oxycontin, oxycodone, Percocet, Dilaudid, Demerol, right? All those 80s, 90s mentality of let's treat pain, chronic pain with drugs led to an entire nation of drug addicts that are all made by the doctors, okay? Why did I have to come along and discover the cause of back and neck pain? What's special about me? Nothing really. I mean, it could have been done a long time ago. Why wasn't it done a long time ago? There should have been a doctor who figured it out, okay? There's lots of clues out there that were available for years. So it bothers me to no end that doctors have basically demonized patients to being drug addicts, drug seekers, when the doctors are themselves the one who created that problem. So I understand what you're saying. I empathize with you. And the truth is that we can fix your pain and get you away from needing any kind of medication. That's why we do these broadcasts, folks. We do it to make people aware that there's now a way to cure back and neck pain without drugs, without therapy needed anymore, without chiropractors being needed anymore. That was a big herniation, but I think we got it. Oh, that's another thing we'll talk about. We never get 100% of the herniation. So no doctor can get 100%. There's no such thing. What we can do at best is 90%. And usually it's less than that. It's going to be around 50 or 60%. There's the nerve root right over there. Let me get a little bit of that right there. There's a little bit of, tiny bit of herniation left, just the smallest amount, just below the nerve root. I want to get that right there. And you can see the tear that's there is going to heal beautifully, right? And some people say to me, isn't that a big tear? Yeah, it looks big, but it's not that big, right? So let's see. We'll come out of the tear. Remember, the inner diameter of the tube is about 5 millimeters, okay? So there's what's left of the tear, and it looks good. It's less than the 5 millimeters, right? The tear is probably around 4 millimeters. So that's got to heal up. It will take time, but it will happen. I'm pretty happy with that. There's just a little bit left right there. I don't know if I can get that. Let me try one more time with the laser. Remember, we're not going to get 100, so I'm not going for 100. I'm going for a therapeutic effect, meaning getting rid of the back and leg pain. You're always going to end up leaving some. And if you go too hard and you're too sweaty about it, you're going to end up hurting something in the patient. You'll hurt their nerve. You'll give them a complication. I don't want to do that. I want to get as much as we can safely that gets rid of his symptoms permanently for the rest of his life. That's my goal. Permanent effect, but not structural effect, physiological effect. All right, any other questions?
Yes.
That's it.
We have a question from Teresa on Facebook.
Yeah, type up your questions for me, and I'm going to answer them. Either I'll answer them right now or I'll answer them in a few minutes face to face. But I'll take Teresa's. Thanks, Henry.
At this moment, just one question from Teresa is asking, hi, Dr. Deuk, can L2 to L3 bulge cause knee pain?
Yes, an L2 to L3 bulge can definitely cause knee pain, but the pain will wrap around from your back, around your waist to your knee. It will not be just in the knee. If you have just in the knee pain and it's only in your knee, then it is not coming from your back. It's coming from your knee. And the doctor is probably missing the cause. Could be a torn meniscus, could be a torn ligament, could be arthritis in the knee. But if the pain is isolated just in your knee, it's not coming from your back. If it wraps from your back around to the knee, like shooting around, then it's from a pinched nerve at L2-3. It's a very good likely candidate. Best thing to do is to do a MRI review with me, and I can tell you, but that's a quick and dirty answer for you. All right. Everything went very well, no problems. We're done. He was a single level L4-5 adjacent to the fusion that was already done by another doctor that did not work. That fusion was done how long ago? 12 years ago? 11 years? Huh? 12 years ago. He had his fusion. He's been living in agonizing pain for 12 years after his fusion. And he was recommended to have more fusion, and he said, no, I'm not doing that. Not by me, it was recommended by another doctor. So all these patients that you see having the Deuk laser disc repair, about 90% of them have already seen spine surgeons who recommended fusions, laminectomies, things that just won't work. And they come here instead. Let's take a look here. You guys can see the incision, a little bit of plastic there. We use a plastic coating. It's full of iodine. It keeps any kind of infection from happening. It's very expensive, but we use it anyway. You guys see the incision right there?
Yes, we do.
So once again, we did the whole surgery through a tiny 7 millimeter incision. Okay, we're gonna put a Band-Aid. We're done. Great job.
Yes,
Oh yeah. Oh yeah. We'll do a stitch. I guess we'll do a stitch. We'll do one stitch and then we're done.
So far, we have one more quick question. This comes from Charlene on Facebook
Sure.
asking, can I set up a Zoom today since you are done with surgeries for today?
Oh, that's wonderful. No, you can't, unfortunately. We do the Zooms all in one day. It's Friday, usually. Though the next couple of weeks we'll do them different days. But the way you do it is you submit your, you go to our website, mri.deukspine.com, and you have to fill out a form, and then you have to submit your MRI. And then once we get your MRI, Sam will confirm all that, and then we can do a Zoom, okay? But without the MRI films and report, there's no reason to do a Zoom call. Okay, needle here. Thanks, everyone. Yeah, sorry we can't do it today. I apologize, but yeah, I'm not that way. I have a very efficient operation I run, and most people don't realize this, but I run the entire Deuk Spine Institute as the CEO, and that means I'm doing administrative work as well for a company with 70 employees and literally thousands and thousands of patients. And I'm involved in every aspect of the company. Overseeing to make sure everything's being done properly. And I wish I had just time to hop on a Zoom call, but I don't. I've got other things scheduled, and I'm happy to do it with you, but it won't be today. All right, let's go ahead and show them one of our patients who had the Deuk laser disc repair. And I'll come answer questions, so type them up. morning, I'm Dr. Deuk at the Deuk Spine Institute here in Melbourne, Florida, with one of my patients who traveled from California. He's been suffering with his lower back pain for years and found us on the internet and decided to come here and have the endoscopic Deuk laser disc repair. We performed that 12 hours ago, and here you are, ready to go back to California, it looks like. How do you feel?
I feel great. It took a long time to get to you. Surgery was quick and painless. I don't remember a thing. Your staff was wonderful, but I am pain-free.
That's awesome. Yeah, and you're going to stay pain-free. We don't have you on any pain meds. We don't have you on narcotics, killing your pain. We didn't put any medicine in your back to stop your pain, so what you have is natural. And do you feel that pain anymore that you had before you came here?
No, the pain is completely gone. In fact, I quit taking my own pain pills 2 or 3 days before I got here. And I am on no pain pills at all, and I feel wonderful. When I woke up this morning, it was a different day, and I feel great.
And I feel wonderful for you for doing that. That's why we do what we do. We can cure pain, and we want everyone to know that, because nobody should have to live with pain every day. How does pain affect your life every day?
Pain is traumatic. The kind of back pain that I was suffering put me in bed. And for the last 3 months, I have been absolutely useless. Absolutely useless. And so I found you. It took me a few months to get here, and it was worth the trip.
It will be for the rest of your life.
Absolutely.
Worth the trip. Pain robs us of our dignity, doesn't it?
It does. It absolutely does.
And your parents are here, and they're very supportive. And that, to me, is so important, that you have people that understand what you're going through. I'm sure your parents have been a big support for you.
Oh, absolutely. Yeah, I was at work, a short story. I was at work last Wednesday dealing with this pain, and my back finally gave out to where I literally could not walk anymore. And I was 600 miles from home. And so I called my mother and father. They flew to San Diego and arranged the trip to get here. I called your place. I was scheduled for February 2nd, and I asked Richard on the phone if he could get me in sooner, because I was desperate. And you guys got me in a week or two sooner, got me in the 24th, which was yesterday. And so we made the arrangements, and I flew here, stayed in the hotel for a couple days, and was operated on yesterday. And yeah, it's well worth the trip. I apologize for getting emotional, but it's been a long trip to get here.
Well, we want you to get emotional, because it is an emotional thing. When you've been burdened with this pain for so long, and then suddenly it's gone, and you realize that life can be lived without that pain, you know, and that you can actually have a life without the pain.
Yeah.
So what are you going to do now that you don't have the back pain anymore?
Well, I'm going to get my life back together. I've got a new job, and they've saved it for me. My boss is wonderful, and I'm going to go back to work tomorrow, actually, if you can believe that.
Yeah.
And I'm going to start riding my bicycle again and getting healthy again.
Well, your surgery went very well. I don't know if you've watched it yet, but we were able to get in with a tiny 7mm 1/4" incision and fix both painful discs, and they were both very painful for you. And the pain was coming from a small tear that's located in the back of your disc where your herniation came out of. And that tear was just so inflamed, and we were able to clean out the herniation that was stuck in your tear and use the laser to debride it. And that's what the Deuk laser disc repair is. It's a debridement of the annular tear to eliminate back pain and leg symptoms. So we also have a cyst. We didn't treat your cyst. And do you think the cyst is causing any problems for you?
At this point, no. I don't think so, because all of my symptoms are gone. This morning when I woke up, I was a little nervous about getting out of bed. But that subsided quickly when I stood up and could stand up completely erect with no pain or bindage feeling in my back.
Yes, when I walked in and saw him this morning for the first time, the first thing your mother said was, "Look how straight he's standing." So they must have watched you suffer for a long time.
Oh yeah, yeah. Yeah, my mom's a great lady. I'm blessed to have her in my life. And then that's my stepfather, Jerry. He's a wonderful man. He and I are pilots. We fly together. We do a lot of things. And he's seen me go downhill. He knew something was wrong, you know.
How did you find out about us?
I've been seeing a chiropractor in Sacramento for 35 years. And 2 months ago, I started to really feel bad. And I would go to him. And after about a month of going to him and going to my doctor for some pain management for these symptoms, I finally figured out that something else was wrong with me. And so I asked the chiropractor, what can we do? Because what you're doing is not helping me. My doctor put me on pain meds, and they took some of the sharp pain away, but nothing was helping. And so being kind of a mechanical engineer, I decided to look into how my back was put together. And I requested an MRI from my doctor and from my chiropractor. And so that took 3 weeks to schedule. That's a long story. And I finally got an MRI, and I looked at it myself and realized that I had a cyst of some sort and that I had some problems with my lower discs. And that's when my chiropractor told me about you. He said, get on the internet and do some research and then call these people. So I called your store. They gave me some information. I FedExed my package to you guys, and a week later you called me. And about a week or two later, I got here.
Wonderful.
So, yeah.
And here you are pain-free for the first time in many years.
Many years, many years.
Congratulations.
Yeah. Thank you.
Is there anything you want to say to your fans out there?
There is. This is a miracle. In Sacramento, everybody that I know said, why are you going? Why are you going to Florida? Why don't you find somebody in Sacramento? And I said, well, because I was referred to Dr. Deuk, and I've done a bunch of research on him, and I just have a great feeling about him. Not only that, he personally called me on the telephone because I told his people that I had some questions, and that's what sealed the deal. And so it took a while to get here, but it was worth everything. And I would recommend anybody send your MRI to this guy, and if he can help you, he will. Okay? Thank you, Doc.
You're welcome, sir. It's my pleasure.
Yeah, absolutely.
All right, go enjoy the rest of your
All right,
life.
thank you.